Hello and welcome to another segment of Interviews That Matter. I am your host Raj Mehta. Friends, in this segment we bring those guests who influence our lives. This includes elected officials, policymakers, heads of major organizations and other dignitaries. It is my sincere hope that the knowledge brought in by these guests will help our community. Today we have such guest, Dr. Vic Politi. Dr. Politi is the CEO of Nassau Healthcare. Dr. Politi, thank you so much for coming here. Appreciate your time.
Certainly.
Today.
Thank you, Raj.
Really. So, Dr. Politi, let me ask you a question. You are a doctor by profession, surgeon, and now you're running the hospital, big hospital. But before that, you made several stops. Tell us something about yourself.
Well,
you're an interesting person.
Thank you, Raj. Well, yes, I'm a physician, an MD. Right. Actually, I did a residency in internal medicine, board certified internal medicine, and worked in emergency medicine my entire career and became a fellow of the American College of Emergency Physicians. They call it a legacy physician because I guess physicians doing it for a long period of time. Experience working at Mary Immaculate Hospital in South Jamaica, and then became the director over at St. John's Queens Hospital on Queens Boulevard in Elmhurst. Where I stayed for many years until 2009, when after the merger with St. Vincent's Hospital failed, and we wound up working with Wyckoff Hospital under Caritas name, and that too didn't do very well. So that hospital system, the Catholic health system in New York City, was put out of business. I then ran a addiction medicine facility called Cornerstone, which dealt with different types of addictions, heroin, alcohol, and different types of other types of drug addiction, which we brought patients in to detoxify and then rehab for a while, and did that for a few years, but left to become a police surgeon with Nassau County, which was always in my blood because before being a physician, I was a policeman.
Oh yeah?
I was a policeman in New York City, and I did regular patrol work in Manhattan and Queens, and then went into the emergency service unit, which is their specialized unit in New York City to deal with emotionally disturbed people, barricaded hostages, and different special types of events like that in the police department. And I became a sergeant and then a lieutenant, and I retired from the NYPD. As a lieutenant, and completed medical school while I was in the police department, which was busy days. They were
Very interesting.
Busy days. Yeah, and then when I left the police department, went full time into the hospitals, became directors and president of the medical staff at St. John's. Then did the addiction medicine piece, and wound up back in the police department in Nassau County as a Nassau County police surgeon.
Wow.
It was there that one day Mr. Mangano called me in to his office and asked me, Vic, he said, is it true you're a policeman, a fireman? I was at Belmore. I live in Belmore. I was a Belmore fireman, volunteer fireman. And I help work with OEM in the city and various other agencies. He said, so is it true you're a cop, a fireman, you have some experience with the OEM and you're a doctor? And I said, yes, it's true. And he said, well, I have a position on my cabinet I have never filled, and that was a Deputy County Executive of Public Safety, and you'll be overseeing all these various departments, police department, the fire marshal's office, the crime lab, the medical examiner, the Department of Health. And he said, you have the background to serve in that capacity. And I happily accepted that role, which I had for the next several years working for Mr. Mangano and for the county. And really gave me a lot of respect for not only the agencies I work for, but Mr. Mangano and his team, because they actually sought someone that might have the qualifications to do that job and put me into that position. And I enjoyed working under Mr. Mangano for many years and overseeing those various departments, and always felt that I was always being given the right advice and always being told to do what's right for Nassau County and always think of Nassau County first. And that was the mantra under his administration, to just work hard and put in many hours, but make sure that everything is the right thing for the county, and that's what we did. And so last year, I understood that the position for the CEO and president of Nassau University Medical Center was becoming vacated, and I applied, put in my application, as did many other physicians and hospital administrators, and I was interviewed, and you know, to my joy, was unanimously accepted by the board as their new president and CEO. And so since February this year, I've been at Nassau University Medical Center, which is an amazing, amazing hospital here in Long Island. It really is. I mean, even living in Long Island myself and driving past it a lot on Hempstead Turnpike, I really had no idea how good of a hospital that is. And you know, people don't look at it that way. They tend to look at the hospital as the trauma center. It's the place to go, God forbid, if you have a car accident or other type of trauma, fall off the roof or gunshot or something, because we are well known and renowned for the trauma services and the emergency department. Right. But there's so much more to that hospital than just the emergency department. I mean, the ER itself, you know, brand new, $38 million, state of the art, you know, has you know, critical resuscitation rooms and surgery, operating rooms right in the emergency department, and it's manned by board certified ER doctors, so that if someone comes in, they're going to get the best of care in that emergency department. They're going to receive the top treatment. And then that's backed up by trauma specialists that we have in-house 24 hours a day, that can come down to the emergency department immediately to attend to victims of trauma. And these are top doctors, and I was shocked to learn they were trained at Harvard and Yale and some of the greatest, Columbia University, some really great schools. And we even have one of our traumatologists is triple boarded, a thoracic surgeon, a trauma surgeon, and critical care. And we have such great doctors that come down to pick up where the ER doctor lets off and carry it right up to the operating room. Right. 8 state-of-the-art operating rooms at Nassau University Medical Center that the surgeons can work with. And then brand new intensive care units. Wow. So our surgical intensive care, our medical intensive care, and coronary care unit is brand new. Matter of fact, the CCU we haven't even cut the ribbon on yet, and that's how new these units are. So they're clean, they're airy, they're bright, they're manned by top board certified doctors, some of the best nurses in Nassau County, hard-working nurses that are there to take care of the patients. So you know, people don't really understand that we have these types of services available, and that's just on the emergency side, on the trauma side, on the surgical side. But we have just about all different specialties. We are well known for our burn center. So if there is a fire or, God forbid, someone has a horrible burn, they can be treated at our burn center. It's the largest in Long Island. It's state-of-the-art burn center. We have our heliport where the aviation units are delivering patients to our hospital for these specialty services. We have a hyperbaric chamber, which is for patients that might have carbon monoxide or more commonly known for scuba divers when they get the bends. Right. But we have one that isn't, it's the largest. It can hold 6 people at once. Wow. Or if someone's critically ill, we can put someone in there with a nurse and a doctor to attend to them while they're undergoing hyperbaric treatment. So it's the largest one in Long Island. It can hold 6 people, a multi-place hyperbaric chamber. And again, it brings a uniqueness to what we provide. We have other services, everything from cardiology. We are in collaboration with North Shore Long Island Jewish Hospital for cardiology, and they're providing a lot of the cardiology services for us. We have our cath lab opened up for diagnostic angiographies, and we're in the process of building out a PCI or a lab that we can do angioplasties and other types of procedures as well. And we're working towards that. So cardiology, we recently won a couple of awards from the American Heart Association for a gold award for heart failure for our treatment of patients with cardiac issues as well as stroke. And so we do have a designation of stroke center. So persons that are suffering from any types of symptoms related to a stroke, vertigo, nausea, headache, or weakness or paralysis, they are brought to our hospital. EMS notifies us of a potential stroke victim, we call a stroke code overhead, and immediately we clear the CAT scan table so it's ready for that patient when they walk in the door. Neurosurgery and neurologists are sent to the emergency department, as well as a neuroradiologist to read that CAT scan, specializing in strokes. So stroke, stroke victims, we're there for them. We have all the latest CAT scan. The CAT scan we have is one of the most advanced CAT scans, 320 slice, which actually is so powerful and so fast that it actually can take pictures of a beating heart and look at the coronary arteries to see if there's a blockage.
Wow.
So it's an amazing piece of equipment that we have available there, as well as 2 CAT scans, and we have MRI as well. So it's a full service hospital for cardiology and for neurosurgery, neurology, for strokes. Other services we provide: gastroenterology. We have full GI labs for both upper and lower endoscopies, colonoscopies or endoscopies to look for colon cancers or colon screening. And these are available to the public, to the residents in Nassau County, with a phone call. They call the hospital, 476 NUMC, and make an appointment, and you come on in, get your visit, see the physician, get a cancer screening exam, whether it's for stomach cancer or esophageal cancer or colon cancer, and we could do that for them right away. Our radiology department, we mentioned briefly the CAT scan, MRI, but we have full echocardiogram for cardiology. We have a full nuclear stress test for cardiology, and we have, as a matter of fact, breast exams. We have a breast imaging center, which we have a large van, a bus, that goes out to various community events to do screenings in the community, and we could do the screenings in the hospital as well. We have a beautifully designed separate area in the Department of Radiology just for mammograms and for women's health, so that they have a certain area. They come off the elevator, they go, the women can go by themselves into a nicely really redone area, and have their mammograms or whatever else they might need in our Department of Radiology. So it's really, it really brings a lot to the table as far as preventive medicine, because we're all about preventive medicine.
Right.
As a physician, it's one thing when you have a heart attack to prevent you from getting a second one or a second stroke or whatever it might be, but if we could prevent these things from happening first, that's where we should really put our energy to prevent that from happening. Whether it's going to primary care, doctors to measure your cholesterol and your blood pressure and your diabetes and your sugar. It means so much in long-term health. If we can keep your blood pressure under control, and we can do that, we can watch your blood pressure, we can put you on medication, keep that blood pressure within normal range so it doesn't cause a stroke or a heart attack. Watch your diabetes, watch what your glucose is doing, and control that with the proper medication or insulin pumps to give you give your body that extra chance of survival, to keep that sugar at a normal level. And there's so many other things that we could do at preventive medicine, whether it's for prostate cancer, colon cancer, breast cancer, screening for lesions on your skin, for melanomas and other types of dermatological problems. All these things in primary care medicine are so important. And to speak to that, we're now opening up, hopefully by March. It's under construction now, and I don't know if anybody's driven by NUMC on Hempstead Turnpike, and if you look in, you can see the whole first floor on the west side of the hospital is all under construction, and it's going to be a very large $17 million primary care center, and it's going to be beautiful state-of-the-art modern primary care, particularly for pediatrics, women's health and obstetrics and gynecology, and internal medicine and all the subspecialties. So you walk right in the front door of the hospital, there'll be a concierge greeter there, and explain what you like, and they'll direct you right to the proper area, internal medicine or OB, GYN, or pediatrics, and we can make an appointment for you right there and then, and register you to be seen. We also have a billing area there, so patients that have a problem with insurance or Medicaid or uninsured, we can help them get insurance if possible, or to work with them with their insurance company to get things done. So it's going to be a one-stop shop where someone who needs any type of these medical types of see any of these physicians, it's right there for them in our new primary care center. We also have 5 federally qualified healthcare centers out in the community that are seeing patients in various areas, Freeport and Oceanside and Elmont and Westbury and Hempstead. So these clinics are out there available for patients to see at any time. So there's so many things going on at NUMC that I could probably go on forever, and obviously I am going on forever talking about them, because I'm really excited about being the president there. I'm really excited about being associated with this hospital. There are so many very, very good things here, and there's so many things that people don't realize, and to get the word out, we're not just Meadowbrook Hospital anymore. We're a state-of-the-art hospital that has some of the greatest services of any hospital in Nassau County. And so for me to be put into this position to as a physician, to see all of these things from my perspective, and to work with such great doctors, I really feel excited. I mean, it's different as a physician to look at the management of a hospital. Finances are key, and in today's world, a hospital is a business, and a hospital has to learn how to survive, how to make money, and how to grow in the business sense. But yet you can't just be focused on the business side. You can't just focus on the MBA aspects of running a hospital. Sure, it's important, and we're going to focus on those areas, but what a physician would look at, or what someone in healthcare would look at more, is the patient and what the patients need, how to bring patients into that hospital, because that's what patients are coming for. They're not coming there to see the MBAs, they're not coming here to see the president or the CEO. They're coming to see a doctor and a nurse, and that's what we need to grow on. We need to make sure that the physicians are there, they're responsive and receptive to the patients, and the nursing care is the best. And I can honestly say that from my experience, that's what I'm seeing from our doctors. So we get the patients in, we treat them right, we give them the services that they require, and the business will build, the business will grow. There are expense side things that we need to look at, and we're trying to work together to cut a lot of the expenses so that we'll be able to grow that hospital, but yet we need to grow a business. And things like our emergency department, our primary care site, our different types of mammographies and radiological services, our internal medicine subspecialties such as cardiology, GI, nephrology, endocrine, allergies. I mean, we have all of these subspecialties in the hospital that are available for patients in the community to come and see. So we're just starting. I'm just breaking the surface of the Nassau University Medical Center. There's so many other things we could talk about, and I think we will. But I should maybe leave a second for you to ask a question, because you didn't give me the high sign to slow down, so I just kept talking.
We are here to listen to you, so it's fine. But I can see it really that your heart is here.
Thank you.
I can really see that, like I have been living in this area for good 30+ years, and I've been watching Nassau Healthcare Center, and I believe that you are the first MD doctor CEO that the hospital has, if I'm not wrong.
I don't know, back many years ago there may have been another physician, but nothing recently.
Nothing recently, as far as I know, right? And I do see that you made significant difference from, you just joined in February, and from February is only a few months, and still you made significant difference. So it really tells us about your leadership skills. See, having all these equipments and latest state of an art, that is great. That definitely helps a lot. But the morale of the people who work there, that's more important. Like, for example, why do I feel that I want to work for you? How do I say that, okay, if I see a leader that you have your heart in it, then I feel like, if I'm working for you, then I feel like, okay, I got to do this. And I believe that that's what you bring in, and that's what I'm hearing from outside, that you do bring in that quality, leadership quality. All this thing that you just mentioned did not happen overnight, obviously.
Yes,
right?
absolutely.
I mean, it has a lot of hard work.
Yes, over many years. Yes, so there's been a lot of movement in that direction to bring that hospital into into where we're at today. But you're true. I mean, every day there's hardworking people, and what I always tell them is that they're so important. Everybody's so important. When you come to the hospital, you expect the medical care and nursing care to be the best. That's sort of like one of the gimmies, automatics, that the physicians and the nurses are going to be excellent. But I stay, every morning at 7 a.m. I meet in housekeeping. And have my first cup of coffee with all the housekeepers as they come on duty, and I ask them, how are things? What do we need to do? What are you guys, what are you finding out? Let me know what needs to be done. And they're more than candid. And I've never seen the place looking cleaner. I mean, that floor is it's immaculate. They really are keeping the place cleaner than any hospital I've ever seen. And they even let me drive that truck that waxes the floor up and down the hall once in a while. So I'm good for that.
So does that, is this like something that your law enforcement background has helped you in this?
Well, yeah, I guess so. I mean, when you're a police officer, you're actually in the community.
Exactly.
And your success basically hinges on how you deal with people, and how you recognize people's feelings and needs, and open yourself up to them, so that you can hear both sides of the story. So when you're a police officer, you have to be able to talk to people and rationally and calmly try to calm the situation down and talk with people to find out what happened. Well, I mean, that helps, but I think it's just being a physician as well. Because if you think being what a doctor does is a doctor sits there and gives you dedicated time, just full concentration to exactly what you're concerned about or what your concerns are. And so the two of them together sort of go hand in hand. But they're doing a great job. I mean, I eat in the cafeteria every day. I have lunch there myself, and I eat what the patients eat, and the food is delicious. And I go there and I'll have a breakfast, and I'll have eggs and whatever they're making, and then for lunch I'll have a sandwich, and I'll drink the coffee from there, and the coffee's delicious. So, I mean, that's what people care about when they come to the hospital. I mean, they know the medicine is going to be good. We're going to have the best MRIs, the best surgeons, the best intensive care unit. But what's what's mom's room like? Is mom's room immaculately clean? How's the TV work? How's the food that she's eating? Does she have enough pillows? These hospitality pieces of healthcare are very, very, very important. We're not taking anything away from the healthcare, and the doctors and the nurses and the testing, everything that needs to be done for that patient has to be the finest and the best. But we need to take care of all the other aspects of their stay at the hospital as well, because no one really wants to be there. It's not a very pleasant experience unless you're on my third floor in my labor and delivery, because that's a happy place. And we just redid the whole labor and delivery area, and it is amazing. If anyone is pregnant, they really have to take a look at this place, because if they look at the third floor at my labor and delivery, it's 18,000 square feet, brand new. You think you're in one of the finest hotels. Oh yeah? The rooms look like a fine hotel room, and then the walls spin around and drawers open up to reveal all the medical equipment. So the bathrooms are even like fancy tiled mirrored bathrooms with showers, and then you come in there when you're in labor, and that's where you stay, and then as you deliver in that room as well. So it's a full LDR, labor delivery room, in that one. So you don't leave there, go to another room. The walls just spin around, and you reveal the oxygen and the monitors and all this other stuff. And lights come down out of the ceiling on remote control. It's pretty cool. Wow, interesting. And so that's our labor and delivery area, which we deliver little babies. We have a beautiful nursery. And sometimes whenever you're depressed or you're overworking, or you have your mind is on dish rip and 400 other things, you'll take a walk down to the nursery and just look at those babies, just playing with their feet and stuff, and it cheers you up a little bit, Wow. So it's nice. But we also have a NICU, a level 3 NICU, which it gives some comfort to the gynecologists and the obstetricians that, God forbid, something should go wrong, that we have a neonatologist standing by, we have specialists, we have nurses standing by in a level 3 nursery, and our pediatrics is there as well upstairs, and we have a PICU, a pediatric intensive care unit, for some of the sicker children. So it's a full service pediatrics from labor to delivery to NICU, God forbid, and then if they have to come back in one time to pediatrics or to the pediatric intensive care unit. So we have pediatricians in there. We have all sorts of pediatric specialists that are there, from pediatric allergists and endocrinologists to oncologists, just about all specialties in pediatrics that are available there. And people don't know that. I didn't know that. And I was working in the building. And
Wow.
every day I walk around, and I think one of the worst things they ever did was give me a set of pass keys to all the doors, and I just open up doors and walk in and see who's in there and say hello and find out what they're doing, and how to make that a better patient experience when they arrive at the hospital.
Wow. So, Dr. Politi, I mean, you have made a tremendous and remarkable difference in the hospital, at the Nassau County Hospital. So congratulations for that first, in a short time. So I really want to congratulate you for that. And I've been hearing all this thing, I already mentioned before, but I do hear about your, the way you do things, which is really, to make patient better, feel better. So appreciate it very much. So let me ask you this question. Why would a patient or a patient's guardian or whoever it is that choose one hospital versus the other, and why Nassau Healthcare is now better than other hospitals like LIJ or something like that?
Mm-hmm. Well, all hospitals in Nassau County, we're very blessed. We have a lot of very good hospitals, a lot of excellent physicians, a lot of resources here in Nassau County that you can't find anywhere else in the country or the world. So we are blessed here in Nassau by having some of the finest hospitals, institutions. The Nassau University Medical Center was always known as the county hospital, and that was always looked at as a hospital for patients that didn't have insurance or, God forbid, had a car accident. And so it had a reputation like that over the years. And during sometimes financially hard times, sometimes areas of the hospitals were neglected. And so patients tended to go to what was new and what was modern and who built the newest wing. And advertising is marketing. What kind of marketing is out there? Physicians in the community also affiliated with different hospitals and would like their doctors to, their patients to go to various hospitals that they're affiliated with. So what we're doing now at NUMC is changing that, and we're painting and cleaning and modernizing and upgrading so that the actual physical plant is on par with any hospital, and that when patients come in and they sit in a room and they look around, it's to their standards. And so we're making the physical plant as appealing as possible. We have the finest physicians, we have great doctors and great equipment. We just need now to get the word out to to the communities, to the physicians. We're trying to recruit physicians to join our hospital on hospital staff. So we're looking at the community physicians that haven't already dedicated themselves to one hospital or the next, that they could come and join our medical staff and bring their patients in. See, different priorities change over time, and at times the hospital focused on different areas. Maybe it was on government funding, whether it's a HEAL grant or a VAP, Vital Access Provider grant, and they gave money from federal government and state government to help us provide for some of the underserved populations. And we're still doing that. We're still providing for the underserved. A good portion of our patients are Medicaid patients. So we really look at those patients, a significant number of patients, and try to do everything we can to help those patients. So there are federal and state money that's available. There's something now called DSRIP, D-S-R-I-P, stands for the Delivery System Reform Incentive Payment Program. And that's money from the federal government, from CMS to the state, and that is to give to safety net hospitals. And in Long Island, Long Island Jewish is a safety net hospital, North Shore Long Island Jewish. The Catholic Health System, Mercy Hospital in San Francisco and St. Joe's are also considered a health safety net hospital. And UMC, we're a public safety net hospital. So those are the three safety net hospitals right now in Nassau County, and that money is available to us to help work with patients and to basically change the whole thought of healthcare from being something of sick care to well care, something from a volume-based type of system to a value-based system, so that no longer you paid for how many patients you see and bringing volume in, but more how much value you bring to the table and how well you keep patients healthy. And that goes back to the preventive medicine and our FQHCs and our primary care doctors, that we get patients and we treat them sooner than later, and so we stop them from developing heart failure or having their sugar go out of control or their blood pressure too high, and then by doing that you prevent their admission to the hospital by keeping them healthy. So there's so many things going on with that, and it could be simple like stop smoking and alcohol and wearing your seatbelt while you're driving, and different things for with children to make sure that they're aware of crossing into green and not in between and all these other things that we try to teach our children to prevent them from having to be hospitalized. So there are a lot of mechanisms to do that, and there's funds for us to do that through some of these VAP HEAL and district monies that are becoming available, and that's something we're not discounting, and we're welcoming that, and we appreciate all the help. We're getting really great help from some of our senators and assemblymen here in Nassau County, right up to the governor, that are really helping Nassau County, care for some of the uninsured and underinsured patients that do live in Nassau. See, people think in Nassau is a very affluent community, that there's lots of rich and wealth, and yes, there is in certain areas in Nassau County, but we still have areas of patients that are in need of health care, some patients that in need of insurance, and under the ACA, American, the Affordable Care Act, that is termed Obamacare, that'll get more, allow more of the uninsured to receive insurance, but there's still the undocumented patients that are not available for insurance under the ACA, that we still need to care for, because they are people and they become sick, and we need to stop them from getting sick and help them before they come to the hospital. And when they do come to the hospital, provide them with the care that they need. And so that's the role of all the safety. I mean, all hospitals provide that care.
Yeah, ACA actually is applicable to every hospital, correct?
Yes, correct. That's a federal program.
It's a federal program.
The Affordable Care Act basically is providing insurance to some extent, Medicaid type insurance to patients. So that they have some insurance. I mean, there's a lot of issues with that, and that could be a whole nother show when we talk about deductibles that are associated with that, and some of the other things that we need to work on and to overcome, but it's a start. It's a start to get patients into the system, because the sooner we get them in and we start to treat them for any of these comorbid conditions, the better we are in the long run, and preventing them from having catastrophic illnesses like heart attacks and strokes and cancers that have grown to the point where we can't intercede and correct those issues. So so we've been out there, we've been doing a lot, as you've mentioned. We've been receiving some great awards. We talked about gynecology and obstetrics, that new OB-GYN area that we have, and the new primary care, but we just received a 5-star rating from a nationally known group for our GYN surgery, and we received it for 3 years in a row. Only hospital in Nassau County to receive that. So that's a really great accolades for our doctors and our surgeons. Things that our OB-GYN services provide to our patients are being recognized. We received an A from a Leapfrog, a nationwide hospital rating group, Leapfrog, an A for patient safety. And when I mean patient safety, I don't mean crossing the street or walking down the steps. We're talking about IV line infections and urinary tract infections and many other issues that might hamper a person's getting better quicker in a hospital. And all of these parameters and all these benchmarks and milestones, and when you look at the numbers, that we're meeting them, and we're exceeding what was expected of a hospital. And so we're receiving all these different types of awards quite frequently. I mentioned the American Heart Association for heart failure and for stroke as well. So we're constantly striving to do better. We're a level 1 trauma center, and so level 1 is the highest level of trauma centers you could be, and we have all the backroom stuff to support that, and that works great. One of the things we didn't talk about is other services such as orthopedics. You would assume, since we're level 1, we have a lot of orthopedics, and we have a great orthopedic group in the hospital that works within the hospital with the surgeons and some of the finest orthopedic physicians for any type of spinal surgeries or back surgeries or fractures. We're right there. They're in the hospital. They're ready to go. We just hired a new neurosurgeon, a young female doctor from, she had her undergraduate, she did college in Harvard, she went to medical school in Columbia, she did a residency in Columbia, then she went out to the Swiss Institute in Seattle for her fellowship, and now she's our full-time neurosurgeon. It's amazing, and we're so happy to have her on board, and to add to our list of physicians. And people don't realize these are the quality doctors that we have there. And after that, we have, and we're actually on the 9th floor building a whole new wing for orthopedic and spinal care. So this is going to be a beautiful wing that's going to be dedicated with its own nurses station and beautiful floors and walls and lots of light coming in for orthopedic patients and for patients that have spinal surgery or any types of injuries. And one thing we have, it's really fantastic. Another thing we have that's really fantastic is our physical medicine and rehabilitation. We have a whole floor, the 5th floor, dedicated to physical medicine and rehabilitation. And what that is that after you have your stroke or you have your fracture or whatever you have, we admit you to this floor, and the floor is amazing. We have physical therapists, occupational therapists, speech therapists, all specialists to help you get back on your feet. Matter of fact, on the floor itself, we actually have a mock home, which has a bedroom, a kitchen, and a laundry room, because we take things for granted, like making a cup of coffee from an automatic coffee machine. And yet, if you had a stroke, you may have a difficulty doing that. So we have a coffee maker, and you have to put the coffee in it to make your coffee. We have a washer and a dryer, so that we can help you to do laundry when you get home, or help you make your bed, or even just set your alarm clock, or do things like this. So we actually have it looks like a small 1-bedroom house on the 5th floor that has all these things in it, vacuum cleaners and ironing boards and things along those lines. We have another room there that's set up as a store, like a supermarket, and with the shelves to help you reach to get stuff and teach you how to use some assisting devices so you don't overextend yourself trying to get some devices. ATM machines, you know how to, and these are things we take for granted because, we have all our arms and our legs and we can move everything perfectly. But if you've had some sort of trauma or you've had a stroke, you may need to relearn these types of things. And so our physical medicine and rehabilitation center is so well known is that the other hospitals in the area are actually sending their patients to us for several weeks to go through this rehabilitation. And that's our inpatient. And down on our ground floor, we have a very large outpatient physical medicine rehabilitation. Again, coming off Hempstead Turnpike, just drive down to the lower level, stop your car, walk in. You have full service physical therapy downstairs as well.
Wow. I think you're taking care of a lot of small little things, which is very important for anybody, to psychologically. Because I think, when a patient comes in, they want to feel like, they want to feel good, I mean, half of the problem is psychological problem, right? So once they feel good, then I think it makes a big difference. So you've really taken care of that aspect of it. And another thing they look for is the speed of caring, speed of like doctor saying doctor and all that. So I'm sure that you have done that also in ER, how long people have to wait and all that.
Yep, we have increased our emergency department throughput time. Basically, at one time, patients were being boarded in the ER for long periods of time, where you would be in the ER waiting for a bed. Well, we opened up additional rooms, additional beds, and have additional nurses, so that basically we don't have any boarding problem at all. We're probably one of the few hospitals that can actually say that once we put through the admission in the emergency room, that there's a bed either ready or being made ready available for you to go upstairs. So you don't have to spend a lot of time in the emergency room. And what that does is it makes more beds in the emergency room available for more patients to come into to be seen by the physician. We've virtually almost eliminated the waiting room where patients come into the ER when you walk through the main entrance. There's a greeter, and you tell the greeter what's wrong, and you'll be immediately sent either to a fast track area for colds and flus, and sort of like an urgent care center that's in the hospital itself, or if it's something more serious, sent right back to the main ER, will be put into a room. Now, in the new rooms, believe it or not, in our ER are all individual private rooms, and they're not curtained. They're actually walled-off rooms with sinks, and they each have television. So not only do you have your own room, you have your own television if you have to wait. And most people aren't in the mood to watch TV in the emergency room, but it's there. Just to give you an idea of the level of comfort that's in that emergency department. And our fast track area is sort of like an urgent care that you see developing all around these small urgent care places. But the difference between us and urgent care is you're in the hospital, and if you do need a specialist, we have them. If you need an MRI, we have them, or a CAT scan, it's available. So if you go to an urgent care center, these might not be available. You may only have an emergency room doc there for you, but here we would have an endocrinologist, we have an allergist, we have a neurosurgeon that's available to come down and to take care of you. And if, God forbid, it's something more severe, we could admit you to the hospital, or the EKG or the chest pain that you feel is really something we can take care of that at the hospital with medication that they may not have in one of these urgent care centers. So they have their place in the community for various reasons, but when someone's really sick, there's no substitute for the hospital.
Right.
So we all have a very rapid throughput out of our ER, very quick time to be seen by the physician.
Right.
As such, we have a very, very small leave without seeing a number. We watch everyone who comes in to see how long they wait, and basically their patient satisfaction at the end. We've been doing pretty good, and there was always room to improve, but we have a great ER crew that's tries to stay on top of these things. With our new primary care center, hopefully we'll be expanding services to get more primary care hours available for patients that want to come in. Again, and I think I said the number before, but it was 476 NUMC, 476 NUMC. And so that's available, for patients that want to come in for routine care as well.
So all these, doctor, all of these equipments and all these improvements in the hospital building, that all takes money. How do you manage your finances?
Well,
because the hospital has to, it doesn't need to make money, but at least it has to be, par, not in red.
It's true. And it's tough because of the populations that we do have that we do serve, where Medicaid patients, the amount that you receive really doesn't cover the bill, as well as the uninsured. We have about 25% of patients uninsured, so it's very, very difficult to break even making money when you're treating patients as a safety net hospital, and we welcome those patients. We want those patients. We are that hospital to take care of all patients, no matter if they can pay or they can't pay. It does not matter to us. We want you to come to our hospital for treatment. And so we have to look at different ways of doing this, and that is bringing in specialists such as our neurosurgeon, subspecialties in cardiology such as our cardiac cath labs, doing more endoscopy and more procedures that are really truly needed by the communities, but they're not receiving them as far as preventive medicine. So there are monies available, there are grants out there, and we do look for different grants when they do become available, and we certainly need them. But you need to look at a hospital as a business as well, and try to grow those services that the patients need, and market it. And when they do come, give them a positive experience, because you'll have 100 patients that have a great experience. You'll never hear from them. But one patient, for some reason, doesn't have a good experience, and you'll hear from them. And so we have to work to make sure we don't even have, not even that one patient that doesn't have. And that's a pretty lofty goal in any industry, particularly healthcare, when unfortunately you do have people that are sick and that do have bad outcomes based on their disease, not even anything that we could control. And so there's always that feeling that we in the hospital could do more, but sometimes in certain diseases you just can't, and you can do as much as you can.
Viewers of our show is all from South Asia, and I know you have got many doctors from South Asia in a hospital, and we have a huge amount of healthcare practitioners in the South, our community. So tell us about what do you do for the communities? Like, you mentioned before there are various different communities that you go out, reach out to them. And tell us about that.
Yeah, we're in a very ethnic diverse area, and we try to appeal to all different communities. And so we'll go out to different church groups, different synagogues, different mosques, and talk to people and sort of explain to them what we have and how we could be receptive to their particular needs, because everyone has their own particular needs. And so in the Southeast Asian community, maybe that means certain types of meals, certain types of prayer time set aside on Friday afternoon, which we do, and you know, provide mats, and just try to appeal to different populations. We do have a lot of Southeast Asian employees at the hospital, a lot of physicians, nurses, pharmacy department, just about everywhere you go in that hospital. And so I look to them to help me. We have a language interpreter on service. When you walk into the main lobby, there's a door, a beautiful office, says language services on it, that we can have someone who speaks various dialects and languages that make people feel comfortable. Because one of the hardest things in medicine is trying to translate to someone that doesn't speak the same language as to what is wrong with them, what we're doing, and it's a frightening experience to begin with. And then if you can't explain to someone what you're doing, or to understand, so they understand what's wrong with them, or that they're going to be better and that we're going to help them, it makes it worse. So we have that services, we have those services in the hospital for different languages to be available 24 hours a day, 7 days a week, to talk to people and calm them down and to explain to them exactly what's going on. And then we try to look at people's different, you know, uniquenesses, and whatever it might be, whether you know, it's in the South Asian community, the Latin community, the African American community, and we try to appeal to them to work together to make them feel comfortable while they're in the hospital.
Good. I think, you know, that does it for our show today. Actually, you know, we definitely want to come, have you come again here in some future dates.
Sure.
Yeah. So appreciate your time, really.
Well, thank you very much for having me and giving me the opportunity to just talk a little bit about NUMC, Nassau University Medical Center, and to get the word out that we really are improving daily, getting better, and that we would like for everyone to take a second look and come back. And you'll really be surprised from the second you walk in that door of how nice, how clean, and how modern, and just about the care that you're going to receive there at Nassau University Medical Center.
Well, I definitely want to congratulate you on in a short time. You've done a lot, so we want to wish you all the best, you know, for future. And whoever comes over there, treat them, make them better, and that is the best reference you can ever have.
Thank you.
For a hospital, or for any business rather.
That's true. We'll do the best we can.
So, you know, thank you for joining us today. If you have any questions, comments, you can email me at rajmitv@gmail.com. That's again rajmitv@gmail.com. You can watch our prior shows on YouTube at youtube.com/Infosys International. That's again youtube.com/Infosys International. Until next time, have a great week.
Thank you, Raj.
Thank you.
Thank you very much.